Hey friends, welcome back to my YouTube channel. My name's Connor, I'm a fourth year medical student at King's College London. This video is going to be part of a series of videos all about your medical school interviews. We're going to be focusing on different questions that might come up, looking at the common themes, how to answer these questions. I'm going to give you how I would answer these questions, and then we're going to discuss the pitfalls of this question, what they're really looking for in this question, and key things you should try and include in your answer. When I ask the question will come up on your screen, and you can have a read of it, and I would encourage you to pause the video and have a little think about how you might answer that question before then listening to my answer and discussing the common pitfalls. The question we're going to be looking at today is, why do you want to study medicine? Now, this is one of the most common questions asked in interview. It's one that I think everyone expects will come up and almost everyone will experience being asked. Luckily, it's one that you've already partially answered by just writing your personal statement. Almost everyone will have dedicated a paragraph, maybe at the start or the end of their personal statement, as to why they're applying for medicine. So you just need to have a look at that, have a look at what you've said, and then try and formulate that into kind of an interview answer. It's important that you don't deviate too far away from what you said in your personal statement. Obviously, we can all evolve in the 6+ weeks it's been since you submitted your personal statement, but it's important that you don't say something entirely different to whatever you said in your personal statement, because your interviewers may have that in front of them. So why do you want to study medicine? I'd encourage you to pause the video here, have a think about your answer, press play, and then I'll talk through my answer and we'll talk about some of the common pitfalls. So how would I answer this question? Well, I would take something similar to what I put at the start of my personal statement, and I would try and give that in a kind of interview answer. So my answer, taken and adapted from my personal statement, would be, I aspire to be a part of the extraordinary and dedicated team that is at the heart of the NHS. As a doctor, I would relish the cycle of learning, adapting and improving that leads to excellence in care and procedure. I'm fascinated by advances in medical research that could one day become available to the public. My recent experiences as a volunteer have strengthened these feelings. So what have I actually said in my answer? Well, I've directly answered their question about why I want to study medicine. I've also talked about some of the things I'd like to do after studying medicine. I've also mentioned my volunteering experience, and that through volunteering I've only strengthened my desire to study medicine. As in any interview question, it's really important that you just answer whatever question they've asked you. That should be the basis of any answer to an interview question, is to answer their question. The first part of whatever you're saying needs to say why you want to study medicine. So in my case, it was that I want to be a part of the team, which I've said is amazing and hardworking, in the NHS. I've then said specifically why I want to be a doctor, and that's because I want to be part of that cycle of learning, adapting and implementing new best practice. So this is quite a good answer to this question. I've mentioned the NHS, I mentioned why I would like to be a doctor, perhaps over another of the allied health professions, and I've left room here for someone to ask me some follow-up questions. I've said that I'm interested in recent medical advances that could one day become common practice in the NHS, and that gives them an opportunity to ask me about what I'm interested in. What have I read about recently? What could be coming down the pipeline and changing the face of medicine? When they ask you this question, when they ask you why do you want to study medicine, they're looking for a few things really. They're looking for one or two real solid reasons why you think studying medicine and then practicing as a doctor would be a really good fit for you. They're looking for reasons that are specific to you and are internal reasons. So many people have family members or friends of the family who are doctors, and they might fall into the trap of saying that they were encouraged to do medicine and that's why they're applying for medicine. But there are much better reasons for studying medicine than being told you should. Common pitfalls of this question, we're going to talk through three. I think firstly, people just don't answer the question. They might talk about why they want to go to that university, or they might talk about some other aspect of studying medicine, and they don't specifically answer why they will be a good medical student or why they want to be a medical student. Another common pitfall is people talk too much about the benefits of being a doctor. So being a doctor is very well paid in the UK and internationally. It's not the best paid job for the hours, but it still definitely puts you up in the kind of top deciles of earning. Being a doctor is also very well thought of socially. It's quite a high social standing position, And I really think that it's important not to overlook that. But again, that shouldn't be a reason for studying medicine. Don't say that you're looking forward to the financial benefits. Don't say that you're looking forward to the work-life balance of being a GP. You need to talk about things in the earlier stages, because being a consultant is when you get these kind of real rewards, and it's a long slog before you get there. Lastly, I think the most common pitfall that people might give is their reason is not something that's personal or internal to them. And what I mean by this is that their answer lacks reflection. In my answer, I say that I want to be part of the team, and I say that my volunteering experience that has been strengthened. So clearly I've had to think about the structure of the NHS and where I want to fall within that. I've decided I want to be in a doctor position, and I've done some volunteering, and through that volunteering I've had a look at what that role really means. That has confirmed that that's where I think I would be best suited. This question is quite a difficult question for universities to kind of mark you on, especially in an MMI. And this question might come alongside some other questions about your commitment to medicine or your commitment to that specific university. So commonly in an MMI, so an interview with multiple stations where you might have between 5 and 10 minutes to answer a question, this will be the first question they ask, and they'll follow it up with questions such as, what have you done to show you're committed to medicine? What have you done to explore other careers in healthcare? How do you know that medicine is the right fit for you? Why might you want to study at this university? And if you weren't doing medicine, what would you do? So it's probably a good idea to have a think about those other questions and start maybe formulating answers to those too. If you're preparing for an online interview currently, or you're hoping that you're going to be getting offers, now is definitely when to start doing your preparation. The best way you can do that, especially for online interviews, is with a friend or even by yourself, videoing your answers. And if you're doing this with a friend, you can do it with a free Zoom subscription, and you just record your video either to the cloud or to your personal device, and then viewing it afterwards and having a look at your answer. Have a look at your body language. Are you sitting upright? Are you articulating what you're saying by moving your hands and gesturing, or is it just a distraction? And your words, are they coming across clear? Are you coming across as being thoughtful, or are you coming across as if you're memorizing a script? I really hope you found this video useful. If you have, please remember to like and subscribe. Press that little notification bell and you'll get notified whenever I upload a new video. There's going to be tons of videos coming out in the next few weeks, all about medical interviews, because 'tis the season. And make sure to check out the other videos in this playlist for more medical interview advice. Thanks so much.